Hello South Africa, John Steenhuisen, leader of the Democratic Alliance, and welcome to this week's edition of Coronacast, your twice weekly channel to keep you up to date with the latest information relating to the coronavirus in South Africa, and obviously having different guests and trying to share as much information as possible with you at home so that you have the knowledge to be able to beat the virus, to flatten the curve, to stop the spread, and to get through this difficult time in South Africa's history. This is our 8th broadcast since we started the Coronacast, and today my guest is going to be the Western Cape Premier Alan Winde, and I know a lot of people have been sending through on all the shows their questions around the much vexed question of cigarettes. So I'm sure that when we get on to that particular segment of the show, we will hear from Alan about what the Western Cape government's approach is and what they've been doing. I was very proud this week that we launched our working paper on what we call a smart lockdown strategy for South Africa, which looks at ensuring that we can keep our economy moving at the same time as focusing on saving lives in South Africa. I hope all of you got to watch the excellent presentation yesterday by Professor Karim, which was really a very, very good explanation about where we are at and what needs to be done going forward. And certainly, a lot of the information last night completely underpins the DA's smart lockdown model and precisely how we can start to move towards a phased approach. One of the key takeaways from the professor's piece yesterday was how coronavirus is going to be with us for an extended period of time, 18 to 24 months at least. So those of you who are thinking that at the end of the lockdown period we're going to go back to business as usual, that's not the case. South Africa is going to be battling this virus until we find a vaccine or until there is a conclusive treatment for it. And so you need to stay tuned to our Coronacast to keep you up to date with what you should be doing. We welcome the extension of the hard lockdown by the President. Hard lockdown at the beginning of a crisis is exactly the right thing to do, and that is why we have supported government's efforts in this regard. But a hard lockdown in itself cannot be a permanent strategy. You can't keep an economy or a country on hard lockdown for 18 to 24 months. The human impact of that, on people's livelihoods, on the ability to feed their families and be able to ensure that they have a job to go back to when this is passed, wouldn't be able to sustain that. And that's what underpins the smart model that we were able to present. So we've got to use these next 2 weeks ahead of us to massively roll out testing, tracing and tracking. We should be testing between 17,000 to 30,000 citizens a day, so that at the end of this hard lockdown period, we'll have enough data sets to be able to really give us guidance on the way forward. It may be another few weeks of hard lockdown. It may be that we can start to open up sectors of the economy, but obviously making sure there's strict observance of social distancing, the use of PPP. We also want to make an appeal to any tech companies out there who can assist government with innovative ways of helping with the testing, tracing and tracking to make sure that you use our website or get hold of government and offer your services. We're only going to beat this virus if we all stand together. And it's going to require the best of all South Africans coming together. And that's why it gave me great pride to be able to put on the table that working paper with President Ramaphosa. I received a very nice letter from his office this morning thanking me very much for the suggestions and saying that they would certainly be taken into consideration going forward. That's the DA's contribution to working collaboratively with government to come up with the best ways possible to beat this virus. We're standing on the front line alongside President Ramaphosa, Minister Mkhize and his team in battling this virus and ensuring that as South Africa, we win in this great battle against Corona. As you know, we are going to continue to accept your questions. And remember, if you've got questions that you would like answered on a variety of topics, you can get hold of us at coronavirus@da.org.za. That's one word, coronavirus@da.org.za. We also, after each show, put up important questions, frequently asked questions that you may have, and information that emerges from the show on the dedicated DA website for coronavirus, and that is da.org.za/defeating coronavirus. That's one word, defeating coronavirus, because that's what we all are going to do. We're going to defeat this virus. Remember as well that if you've been the victim of abuse by any member of the security services, military, SAPS, or any Metro Police, you can also report that in two ways. We have a dedicated WhatsApp line, and that is 067 977 9324, or you can use the dedicated email address we have, which is reportpoliceabuse@da.org.za. Those numbers and addresses should also be reflected on your screens. Please let us know if you or your family have been a victim of any police brutality or unlawful behavior. So on to this week's statistics, and we saw yesterday, just after the great presentation by Professor Karim, that South Africa now has 2,272 confirmed cases of coronavirus with 27 confirmed deaths. We again extend our sympathies and condolences to the family and friends of those who have lost their lives as a result of coronavirus. And it's when we do this that we remember just how dangerous this virus is and just how important it is for us to stand together on the front lines in fighting coronavirus. I want to remind you as well during this time, no panic buying. We don't want to see people with huge trolleys just hoarding food. We don't need to create panic. We've got to be calm and deliberative at this particular time. No panic buying. Making sure we're practicing hygiene. Make sure you've got your hand wash handy. We've got our own one in the studio, which everybody has to use if they come anywhere near us here. And hygiene is very, very important, particularly in those areas where self-isolation and quarantining is not that easy. Focusing on a hygiene-based approach is even more essential. So if you don't have access to hand wash, you can use ordinary soap and water, washing your hands for at least 20 seconds. And remember, stay at home. The whole point of this hard lockdown is to flatten the curve and stop the spread. This lockdown's coming at a huge price for South Africa. Some economists have estimated it costs us around 13 billion rand a day to our economy to shut it down in the way that we have. So let's make sure that the trade-off is worth it. Stay at home, flatten the curve, stop the spread. If you've got the symptoms, go and get tested. It's very, very important. And remember that those who can must self-isolate, particularly those in the vulnerable age groups, our elderly citizens. As Professor Karim said yesterday evening, the lockdown for many of them is probably going to be even longer than the lockdown for other age groups. And so please bear that in mind. He's suggesting that people who fall in the vulnerable age group would probably have to remain in some form of self-isolation or quarantine or lockdown till at least September. Remember, the hard lockdown isn't going to kill the virus. What the hard lockdown is doing is buying us time to be able to get data sets in and to prepare our response to the virus. And so please, no social events. We've seen some ministers get into big trouble this week. Don't be like them. Set the example in your community. Stay at home, no socializing with and going to friends' houses and going to parties and the like. That's not what this period is for. It's a few more weeks to go. We're going to get through it. We're going to get through it together. Next Friday, this coming Friday, we've got Jordan Hill-Lewis, and he will be in conversation with me discussing our smart lockdown strategy and our efforts to mitigate the economic fallout from this crisis. It's very important that we do focus on the economy, because it is the economically active citizens of the country that finance the health response in South Africa. The doctors, the nurses, the ventilators, the equipment being used in hospitals, all financed through taxed income that the state receives from economically active citizens. So it is important that if we're going to have a comprehensive health response going forward for the period the virus is going to be with us, that we do also focus on ensuring we keep the economy open and moving. I'm going to move over now to Alan Winde, our Premier, and I know everyone's been very, very excited to have him here. So Alan, Welcome to Coronacast. Alan is the Premier of the Western Cape and is leading the DA response here in the Western Cape and the Western Cape government's response. Welcome to Coronacast, Alan.
Thanks, John. Really good to be here. And perhaps if I can then just say a few things about what we're doing in the province. And of course, the provinces have within the regulatory environment a certain role. Our job is the Joint Operations Command, how we bring all of the work streams together and how we link it to all of our local governments. And it's been a roller coaster ride for the last couple of weeks. I still remember before we'd even had a declaration, how we'd already set up our top management team, our Joint Operations Command, put them in place, got them to operate 24/7. We put 4 work streams in place. We've got 9 work streams now. Yeah. Because as this thing rolls out, and I think the points that you made and what was made last night by Professor Karim, the kind of work that we're doing at the moment, the flattening of the curve and preparing for what is going to be the maximum infections per week into the future. And whether it's going to be in September or June or July or August or whenever that's going to be, all we know is it's going to be hundreds of thousands of infections. And we've got to make sure we've got hospital capacity, make sure we've got ICU capacity, make sure we've got mechanisms that deal with our patients. But at the same time, we've also got systems in place that keep people fed, that tick the economy over, as what you launched yesterday, making sure that we've got quarantine facilities, we've got vulnerable people, and we've got highly densified informal settlements and places where people live where the virus spreads very fast. So we've got to create those spaces where we can pull people out, quarantine them, isolate them if they test positive, get them through the virus so that they can actually then start to build up immunity across the system without pushing us over the top. And that's the kind of work that each of these streams are doing.
And Ellen, what would you say your biggest challenge to date has been? If you could think of one or two things that have been the biggest challenge that you faced in these preparations.
So the initial part is obviously the health challenge. That's getting, and when you speak about the models, we're refining those models. Hopefully it's either Wednesday or Friday, our cabinet will have our provincial model. We are linked in not only with national but international specialists on designing, understanding and getting that model to be what we could estimate as our best projection. But you've got to, it's an idea. The lockdown definitely is pushing it out further. You can see already. Depending on how fast it spreads in various communities, it'll change that model. But at the end of the day, I think health, number one, getting everything ready, understanding that in actual fact to our population, even in the Western Cape, which we might see as maybe having more health facilities, more clinics and more hospitals, both public and private, you still understand that this thing that's coming at us called coronavirus is so massive and we actually don't have the capability. That's why not only us but the whole world is trying to deal with it in the same way. So that's challenge number one. But our new challenge that's coming is probably twofold. I think the second one is food security.
Yeah. We've got some questions here about people who are starving. I've got some feedback coming from Pamela. Says, how do people in the Western Cape access these things? People are starving. We talk about clashes over food parcels. Do you want to take us through what the thinking is around food parcels, particularly from a government response?
Okay, so obviously there's government, there's NGOs and private sector that are all doing amazing things. And really it is how do we make sure that there's a network that everyone is covered. I think we've got 1.6 million people who sit on social grants in our province, so at least there's a sector of the community that has got some income to be able to sustain themselves. Then we've got people who are perhaps, I want to call them the salary earners, and there are different models happening with UIF claims by businesses, but obviously that's also under pressure and people are finding it difficult because they're having less and less money. But the middle is what really worries me. Those people who were maybe earning a weekly wage every now and again, they don't have UIF, they're sitting at home, they now in lockdown, abiding by the rules, no income. Now they're getting an extension, and they're starting to run out of food money. The electricity money is probably run out, and we need to make sure we're getting to those people. And this is difficult. We've got a GIS mapping system that the Social Development Department are trying in different areas across the province. So we're actually mapping households who've got a grant, who are now getting a food parcel, and then interacting with our call center. And it's quite amazing. That call center started on 2,000 calls a day, then it moved up to 10,000. I think we're seeing at 12,500 calls now. And then how do you get that messaging back in? This is a region, and then we can see the hotspot areas. And then, of course, we're appropriating money for it. We've just put another 53 million in on top of what social development we're doing, and that gives you a month reprieve, 50,000 food parcels into homes. We've reactivated our school feeding scheme, because that in itself nearly feeds 500,000 children, and it's only just started, because there's got to be strict rules. You can't create new frontiers of virus spread.
Yeah.
So you've got to make sure there's social distancing, there's rules around it. People are asking us questions. The opposition's asking me questions about, can we not deliver parcels to the school feeding scheme versus a child coming there with their little bucky to come and get their meal to take home? And of course, these are questions we've got to ask ourselves. It's much more expensive to deliver a parcel than to actually produce a meal. So a few rand to produce a meal, 3 times to 4 times more to actually produce a parcel. But these are the questions we've got to work with in getting the food security passed, and that's balanced with the economy. And I think what you spoke about yesterday is key to making sure that at least some people can get back to work, so you can start alleviating the pressure.
I think the problem is a lot of people see this as a binary. They see it, you've either got to stop the virus or you've got to save the economy, and you can't do both together. I think the global thinking is moving far more towards having interventions on both. Obviously, the primary focus is to save lives, but as you've said, there's a lot of people who actually could lose their lives to starvation, exposure, malnutrition before succumbing to the virus. And also, if you've got a population that is unable to bring food into the home, they then become vulnerable because their immune systems are suppressed. So I think that we've got to move away from this binary thinking and start seeing how we can address both.
Understanding that people are sitting in lockdown at the moment, but if you've got nothing to eat, now your pressure starts building. Eventually, you don't care about the virus, you've got to find some food for your family. So we've got to make sure that network and the call center, the feeding back, getting back onto the ground, understanding where these food pressures are, and then moving in to be able to alleviate that while finding some of those spaces. We really are advocating now for people to just wear masks across the board.
I wanted to get onto about this mask wearing, because there's been a lot of controversy around the world around mask wearing. I've been very clear. I think we need to be the party of masks, and masks have to become part of our culture. Do you want to talk about why masks work and what part they play in combating COVID?
So, and obviously there was that controversy. It's global, the World Health Organization, and maybe in a nutshell to say that when you've got low risk environment of COVID, when you put a mask on, suddenly you touch the door handle, you fiddle with the mask, you touch your eyes, and you actually spread it more quickly. So it's got a tipping point. Right now, wear a mask. It is the safest thing to be doing. Make it yourself. And I've just actually visited this morning. I visited I know of 3 big factories, one in Atlantis, one in Salt River, and one out in Ottery. But so many of these CMTs, people at home making masks. I've got my mask with me here. We've got to get people to wear masks, because I know when I look at the statistics every day when we have a report back in the Joint Operations Command, you can see where the infections are happening, where the risks are. So the risks are right now in our taxis, where people are congregating inside a confined space. I promise you'll be safer off with a mask on. When you go to the shop to get food, that straight away is a place where you congregate. You can see those are infectious spaces. So if we can wear masks, but then, of course, there's a whole protocol around a mask. You must still wash your hands. Sure. You must still follow the hygiene, sneeze in your elbow, etc. And don't fiddle with your mask, and don't touch your face all the time. Yeah. And when you get to the shop, when you leave home, you put it on and you keep it on until you get home. Then you wash your hands. Then once you wash your hands, you take it off, you put it into the wash. Then you wash your hands again because you've touched your mask. So you've got to be quite strict about this to reduce the risk. But I think we need to move to a time where every single one of us are wearing masks to protect everyone in society.
And I think that's important. So, I mean, Alan's got I said he's got the sort of fancy model. I've got the entry-level model here, which I pop on when I leave the house or when I'm going to a shopping centre. And, these are, please may remind that if you're going to get a mask, you don't need a surgical quality mask. Let's leave that for the health professionals so we don't take away PPE from our healthcare professionals and people on the front line. But every South African should own a mask, a cloth mask of some form. And so we're looking at ways in which we can bring up the education and rolling this. But Alan, I think that you're absolutely right about advocating this. And mask wearing, I think, is going to become a feature of South African life for a long time to come still.
Absolutely. This is not a flash in the pan. It's not as if at the end of lockdown we've beaten coronavirus. Coronavirus is here for months and could be years until we've built sufficient immunity. And heaven forbid there's the next one that comes around. But it is going to be part of our lives, part of this new normal that we're going to have to start developing, this sort of post-lockdown new normal, which is how we get back to work in certain sectors. Masks, hygiene, perhaps even in that business, they're going to have to develop their own set of protocols on how to deal with minimizing the spread of this virus. And of course, I think at the same time, I mean, you opened up the conversation about saying how citizens must social distance. We've all got to have that responsibility and continue with that. I mean, this morning, and this is ongoing. This morning, our Minister, Norma French Mbombo, I mean, she was out because we saw a number of long queues outside some of our clinics, and she went out to go and actually have a look because inside we've got very strict rules about spacing and how many people you can deal with at once. But straight outside the door, there was no social distancing, and the message is we've all got to take responsibility. Please, if they're in your space, tell them, just don't be nasty, but just tell them, listen, give me my space. We've got to be able to create that space, otherwise this thing is going to spread like
I saw the most novel way of doing social distancing. I don't know if you saw it. It went viral on social media this week. Perhaps what we'll do is put the picture up on our website, but it was a South African who decided that when he went to the shops, he didn't want people anywhere near him. So he fashioned a hat with pool noodles hanging off it, and so nobody could come with him. I'll see if we can get it put up on our coronavirus website, but I think he wins the prize this week for the most novel social distancing. Alan, let's talk about the question on everybody's lips, so to speak. Cigarettes and tobacco. Cigarettes and tobacco.
Cigarettes, dog walking, I mean, there's a whole range of them. I mean, obviously we deal with those every single day. Just as the DA's got frequently asked questions, we have on our government website as well. And we put through a range of regulatory issues through to the National Department to say these are the regulations or the interpretation of the regulations that we don't agree with or that we're getting from the citizens in our province to say we need to change this, this is an issue, this is a problem. Cigarettes was one of them. And of course, it's one of those things, it's about, again, this is not binary, this is about finding balances. And I always ask the question, when someone comes through and says, can I do this or why can't I do this? Is what that person is requesting to do going to spread the virus more or less, or is it going to have no real impact? And quite frankly, that was one of the product lines, just as it was baby clothes in your supermarket or in your spaza shop, there was a product there that they weren't allowed to sell because it wasn't seen as an essential. That was an interpretation, and we disagreed with many of those interpretations. We actually went so far in this province to get legal opinion agreement between police legal people and our legal people. And of course, when I said our interpretation in the province, well, then we saw Minister Bicky clearly come back and slam it absolutely. Now, I mean, we could make this whole fight about cigarettes, but this fight's about Corona-19, this coronavirus, this COVID-19 virus. We've got to zap this thing. So we've got a list of stuff. We've got some things right. We're exporting some of our agricultural products now again, which we're really grateful for because they were being thrown away and it didn't make any sense. Our economy is under huge pressure. So there are things that are opening up all the time. We're seeing regulatory change. The big question is whichever changes has got to change in the interests of the citizens, because we're free citizens in a country all doing our bit to minimize the spread of a virus. But I mean, this is not a in a concentration camp. But at the same time, there are other products or other things that people ask to be done, and I know that if you opened that floodgate, we'd actually start spreading the virus more. But that's leading up until now, this expansion or the expansion of the lockdown, or the extra 2 weeks. And in that discussion, I think your political discussion with the president was the same as what we were having as the premiers, to say we support that, but you cannot leave everything as it is, that the economy is dying, and that middle that I spoke about, people that were earning an envelope, if they're in a sector that perhaps is not spreading the virus or able to manage themselves, surely we actually now need to open up that sector, and that's how you find
I think the big problem as well, Alan, is that what it is doing as well is creating a huge boon for illegal cigarettes. So cigarettes still being sold, government losing out on massive revenue that could be going towards the fight against COVID, all for no real purpose.
Correct.
So I mean,
but I hear the tax, and the tax thing for me as a province where we get all of our funding through taxing, we've got to give education and health, which are two massive demands on our fiscus. But you know what also really worries me about the cigarette issue, where it moves to this illicit underground market, is so suddenly you need your fix. So now you are stepping out of your home at 3 o'clock in the morning because this undercover guy's coming past, and you're going to buy your cigarettes, and they're costing 5 times the price, and they're all illegally imported through some grey import system, and suddenly an illegal market starts to grow. And then it's the liquor, then now you can buy not only cigarettes illegally, you buy liquor illegally, and then it's probably drugs, and then anything else. So really none of that makes any sense, because what that does is that really spreads the virus. Because suddenly now people are running around. I promise you those people aren't, if they're not adhering to the regulatory rules, they're not adhering to the COVID virus rules. So that really does make sense.
Does make sense, yeah. And so Alan, in terms of going forward and the Western Cape, and what is the next step in the provincial battle against COVID?
Okay, so first of all, our team now is building the model of what we call moving to that post-corona new normal. So business is not going to be business as usual. And of course, straight away, we know that the tourism sector is absolutely not going to be business as usual, because the world's not flying around from country to country anymore. So it's going to be much more difficult to develop that new normal. But for example, maybe that new normal in a couple of months' time will be much more kind of maybe a coach. I spoke to one of our big tourism operators, and maybe a coach has some kind of screen between where you are, and you'll have to wear a mask when you're on a coach. But I think that's far into the future. I think the immediate is, how does a restaurant redesign themselves that they themselves can operate but not have tables maybe for the first 2 months. Maybe after that there'll be some other mechanism where there's screening off of tables where people could actually go. But these have to be developed over time. At least start to allow that business to survive by producing meals that can be collected. But then they have to develop their own rules within the kitchen. New phytosanitary type rules that I think the agricultural department or sector know very well, the food packing space. They do it already. They might have to put 1 or 2 other levels or layers in, but all businesses are going to have to look at what they change.
But then government processes as well. I mean, nothing is going to be left untouched by this. I've got a driver's license that is waiting collection at the offices here. I can't do it. And just think about going forward, government processes in terms of applications for identity documents, passports. The days of long queues or people congregated in small home affairs offices in those queues, those days are over, and government's going to have to completely rethink how it operates.
So we've started in the province with where people would go to the clinic to get their chronic meds. So you're a diabetic, you need to go to get your month's worth of chronic meds. We've started to deliver those chronic meds to your home. So, already, that's not going to revert back again. Who wants to go and stand in a long queue, as you say? I know that we've put a hold on vehicle licenses. We've allowed the expiry dates to go beyond for a couple of months, etc. But I do think the whole of life is going to change. I think working from home is now had a whole new kick boost going forward. But we are going to have to change, and we're going to have to change fairly quickly. I visited a company today that was making masks, but you cannot believe the emotion going through their warehouse of their normal product. They had trucks that were on their way to deliver that were turned around by big retailers. They got all this product, tons of stuff that now can't be sold. That's all been paid for, produced, and no one can. I mean, those businesses are under such severe pressure now to survive even beyond this, let alone reinvent themselves. So I think we've got some tough times ahead. But I also want to say, I think entrepreneurs, this is your time.
Opportunity.
You know, come up with some of those great new ideas, but at the same time, come up with those new ideas that actually enable your business to operate with not spreading the virus.
There was a great interaction I had with a tech company, Alan, a few days ago. That are looking at ways to pay social grants, to be able to put food vouchers in people's hands, not through the traditional method of queuing and waiting for one, but being able to send a QR code to their phone that they can then go and redeem at a store, to be able to help people who are desperate in need of food, but who can't access it through
Are these the guys running the
traditional
pilot
means.
in series?
I think so.
I think,
yeah.
I think
Some
that-
really
so
good
it's-
work being done there.
So the world is going to be different because of this. You know, I can't tell you how many discussions we've all had on the fourth industrial revolution in the last couple of years. It's just taken some giant steps forward.
So talking about the new normal, one of the other key focuses and a big chunk of your budget is education. What is the future of schooling? With a lot of parents concerned, when are schools going to go back? What's the new normal for schools? Has the province put any thought into what that process is going to look like?
So definitely yes. I think luckily we have got nearly 1,500 of our schools already connected through Wi-Fi. So there's at least a connection to a school within a school environment. The question would be that how do you actually make that accessible in someone's home close to the school? Also, I think the cell phone companies and some of the work that the education department, both national and local, have been doing with some of the mobile companies, already producing free content, able to download. In actual fact, the payment happens on this side and not on the side of the scholar, of the learner receiving the information. I think WhatsApp have coming up with some really amazing platforms how people are getting connectivity. And then I think also even through the normal TV channels, you've seen schooling come up much more through our TV channels. So we are working on what is that also a different environment for schools. I think for me the most important is how do we get our matrics to be able to finish, because their school ends far earlier. You're already seeing the national minister talking about doing away with school holidays towards the end of the year, maybe moving exams further out. But that might even be pushed further out. So we have to come up with how can we start schooling now? How do you perhaps go to school to fetch your pack and then link in? And of course, it's easier for some people who've got connectivity. It's much more difficult in communities where you don't have that connectivity. But definitely those are things that the department...
A lot of questions coming through about Mitchell's Plain and non-delivery of food parcels. We need to obviously have a look into that. But, you know, obviously there are teething problems. I mean, this is not going... This is, as you say, the new normal. Often, you know, I don't think the country and the province have ever had to do food parcels to the scale and level that they are having to do at the moment.
Yesterday I visited, so our DSD department, our social development department, they've given it to 4 suppliers. I went to go and visit them yesterday, had a look at their operations. So, you know, these are big organizations, Red Cross and, you know, these kind of organizations do this. That's what they do. That's where I spoke about the tracking. So they're trying to track it through a GIS. So this family at this residence has received a food parcel on this date. At the same time, we're trying to overlay what's happening at local government level, because they're starting to appropriate money now for it as well, trying to identify those gaps. And then the private sector. I mean, I see some of these supermarkets who've got these own, you know, when you go and buy your shopping, you add another couple of tins that goes in and you see tons of stuff being distributed. But it's also, we're learning as we're going. It's brand new territory. Technology is helping, I think, but also the mechanism of how do we get through to a call center to say, listen, I'm trying to social distance here, but I've got no food in the house. I need help.
Ellen, one of the other things, I mean, I think that's also been quite difficult for us to grapple with. And, you know, we see the response in other countries, but we've got a unique socio-economic environment here. You've got lots of people living in townships and formal settlements. It makes self-isolation and quarantining exceptionally difficult. We've had some feedback coming through about homeless people and what they need to do. Do you want to just talk us through what the provincial government is planning around, particularly those areas, as you spoke, around very densely populated.
Okay, so obviously, I mean, we've seen that the directive has said to municipalities, you need to create space specifically for homeless people. If you're homeless on the streets where you used to at least be able to find something to eat, now the street's dead quiet. And so obviously this is not easy because you're congregating people again, which is difficult. So how do you create spacing? But you create a space. So we've seen in different municipalities, specifically our big municipalities around the country, and of course here in Cape Town, not so easy, but getting people to come together. The healthcare side of it is very difficult, the feeding side, but that's homeless. The area that the province is very, very concentrated on at the moment, which is taking lots of funding and lots of work, is identifying the isolation and the quarantine spaces. So you could be in a densely populated informal settlement, you test positive, so then it's about tracking and tracing. We remove you immediately, test you, you are positive, but there's nothing wrong with you. We don't want you to take up a hospital bed, but then we've now procured off-site in B&Bs and hotels and all sorts of places, thousands of rooms. If I think correctly, we had 300 in rooms as of this morning in those various hotel rooms. We had 200 arrive, scientists arrive. Now everyone's got to be quarantined. They've got a period to be locked up kind of in these hotel spaces. It's got to be managed, and that's taking a lot of resource, a lot of time. It's got to be spread across the province, and then it's also got to be linked into your next phase, which I think is even bigger, and that is making sure that that spike, whenever that comes, Professor Karim says September. In September, how many 100,000 infections are we going to have that week? How many people are going to need beds that week? And how many beds have we got? And ICU beds have we got? And what are we putting in place? Because that model is telling us. So we are busy procuring space, beds, oxygen tanks, getting ready for that you see on television sets on what's happening in Europe and in other countries. We're at least a little bit learning for us. We're a bit behind the curve, so we're able to learn a lot of lessons.
I think that it speaks a lot to the question I've just had from Maud Jacobs, who says here, why are you pushing for lockdown to be changed? Many are dying in the UK and America because they're not taking lockdown seriously. Well, there is some valid question in there, but the truth of the matter is we did the right thing in South Africa. What the UK and the US didn't do is lock down early and lock down hard. We've done that, and I think it's very, very important that we know that. I'm also want to make it very clear, Maud, that we're not saying that we must move out of a lockdown. What we have been called for in our smart lockdown phase is a phased approach that allows you, much like load shedding or water schedules, to be able to, looking at the data, be able to determine when you can ease off, when you can. So hard lockdown remains a strategy, but hard lockdown as we are currently is not possible to be sustained over the long term. And particularly as we've heard from Alan here, there are communities where self-isolation and quarantine are simply not possible by virtue of the fact that you've got 6 or 7 people living in a 1 or 2 bedroom home, or a number of people living in a shack. It is impossible to self-isolate there. So we've got to start looking towards a smart lockdown system. We have been supportive of the hard lockdown and the extension. We've fed through some suggestions about how we think the hard lockdown could work better, but we've got to start looking towards some form of phased approach that will allow us an exit strategy from the hard lockdown to make sure that people don't die of starvation, that we're still able to keep livelihoods going, and that people have jobs to go back to at the end of this. If the economy collapses and we fall into a massive depression as a result of that, life is going to be a lot harder for many, many more South Africans. And I think that's what we're certainly not advocating lift the hard lockdown, not at all. We're saying get the data and use the hard lockdown period for testing, tracing and tracking in huge numbers, and then use that data to, in a smart and flexible way, inform your decision going forward. Alan, I think a lot of people don't take the lockdown seriously. Let's just talk about that for a second. So we've got Getriana here says that in Worcester, people are walking around all day. There's no social distancing. I think there's a lot of people who think this virus is happening in the United States or the UK and don't understand the seriousness of it. Have you experienced that as well?
Absolutely,
Yeah.
across the board.
Mm.
And of course, well, let me rather say this. I think it's kind of an 80-20. There are so many people that are doing the right thing, and we must thank them for it. But maybe also linking to the people that aren't listening, and I think it's because our infection rate is actually slowed quite. I mean, it hasn't hockey sticked yet, and it hasn't done what's happened in other markets where you've seen the lockdown almost come a little bit too late compared to ours, because suddenly everyone started panicking, and that maybe has given that false sense of security. 27 people have died, but I promise you, those people that are out there walking around thinking that, you know, it's not going to hit me, I promise you, those are the people right now that are infecting other people, transmitting the disease, the virus, and you know, it's not going to be long until it's their mother, their grandmother, or someone that they know that's vulnerable, and they're actually the one that's actually caused that transmission. And you know, I mean, there's another side to this equation, and maybe what you were just saying about lockdown, and the thing that worries me going into the future is that we've also got to manage it in such a way that we don't have you know, a whole lot of civil disobedience. We don't have even food wars and riots and things like that, because of course then that is exactly how you spread this virus, and then you'll just see it'll go like wildfire. But citizens need to take responsibility, and I think we need to help each other as well.
Sure.
Your neighbors forever walking outside, just say, please, you know, come on, just you need some responsibility.
Because we're all in this together, and I think that's the
Absolutely.
key message. And you know, I think a lot of people, you know, see the DA putting suggestions, they see the suggestions you putting in at a national level, and they see this as an adversarial relationship with government. That's not the case at all. I've said to the President, we're standing shoulder to shoulder with you on the front lines against this virus, and that's why I've repurposed the party to be able to be making constructive suggestions, and I'm sure your government's doing the same.
We have to do that. I mean, you do see these bits of politics sticking their head up here and there, but also you also see strange things happening. So you see adversaries suddenly saying, but hang on a second, I see this in the school feeding at the moment. I've got some opposition coming politically on the school feeding program, but I mean, this is a program that exists, and you can very quickly, as long as you follow the rules, you can very quickly get nutrition to people who need it desperately, and then you'll see normal education opposition from equal education now saying to the country, we need to roll this feeding thing out.
Ellen, a big question coming through here, support for small business. I mean, you know, you were the Economic Development Minister before your time as Premier, you've served in the Safety and Security portfolio. What are we doing as a province to help small businesses to get through this particular time?
So I think, I mean, in line with what you've put to the President, it was the same discussion that I had, was that you can't, this is not a switch that you can turn on and off, this lockdown switch, because businesses are in such deep trouble. So what is it that we can create? And I mean, that's the work that's happening behind the scenes now in the province, so that we can put forward some of our ideas into the economic stream. There's a stream meeting right now, a national economic stream meeting right now. How do we get some of those ideas on enabling the economy to start to open up, bearing in mind that there's got to be rules? And then, of course, what kind of stimulus packages? Now, it's very difficult in a province for stimulus packages, because we rely on a national tax that gets devolved through a division of revenue. So we can't just automatically put billions on the table and say we're going to just make this available. We must try and make it easier for business. We must try and work with business. I mean, we've got Westgrove have got a platform now that they've set up to help with frequently asked questions, enabling businesses, specifically small businesses. I think what we were seeing today is how just in the mask space, how helping little cut, make and trims be part of providing masks that might just put food on the table of a small business which has got nothing at the moment. And that's the work that's happening now, is how can we start to get at least some of the sectors up and running. You know, we've got it right now, the call center industry is now able to open up with certain rules and regulations. I've said we've managed to get export of agricultural products going. So the economics work stream is working day and night to try and open things up, try and enable, try and create an environment that people can work from home, people can get that little bit of economy going, because we know that what's coming is not only a spike in infections in COVID-19, but a massive slump in an economic...
Talking about call centres, you've set up a Western Cape call centre. You want to just share with us the number and what people should be calling through to that?
You talk about our own internal.
Your internal.
Well, our own internal has got certain numbers, but we were going from 2,000 to 10,000 to, I think yesterday was 12,500 calls, and we still got thousands of calls that we're missing. So over the weekend we put a bid committee together, an urgent bid committee, and we've actually got some of the private sector call centres now coming online to help with taking calls specifically on food security, but also on business support, etc., to aid our existing one. And then what we've also done is we've got a whole lot of government officials who actually don't have things to do right now. I mean, I remember Mushfika coming to see me. She's in the event space. Now there's no events happening. She says, what can I do? Can I help? How do we actually repurpose some government officials now who can go online from home across a VoIP system, or to actually help with the call centres, aiding the public, finding out what those pressure points are so that we can quickly react.
Alan, thanks very much for your time today. I know you're very busy and you're heading up the response, and I think it's been fascinating, and judging by the calls that are coming through and the information coming through, you've certainly stimulated a lot of the debate. So thank you for making the time to be on Coronacast, and I hope we're going to get you back again soon. It's always very nice to see the problem from a government perspective as well. For those of us who sit in the National Assembly and others are opposition parties, I think that there's a burden on government in this, and I think it's very good. So
it'll be great to come back with once our model is finalised and agreed to. I don't want to kind of create a war in our model, so we need to get it aligned. But to actually then start to project what week 23 and week 24 and week 25 is going to look like, so citizens can understand what's coming at them. And then maybe also when our economics plan is submitted, do the same thing and come back and say, this is what we've put in.
Well, thank you very much, Alan, for making the time to be here. It's been great to have you there. Well, there you have it, folks. Western Cape Premier Alan Winde taking us through the Western Cape government's response. It's been a fascinating discussion, and as Alan's committed to coming back on to talk about the model. We're also very excited that Michael Cardo today made a suggestion to government, DA MP on Labour, that because UIF is struggling so hard to be able to distribute, and we've had a few questions come through about how do they access UIF, lodge complaints, haven't heard. Michael's made the suggestion that we allow SARS to be the facility that pays out the UIF TERS fund to assist businesses in trouble. So thank you very much. Well, that's all we have time for this week. Remember, South Africa, Alan's message about masks. Make sure you get a cloth mask, make your own, fashion your own, but in all public spaces, all of the time, let's switch to using masks. My shout out for this week has to go to Professor Karim for that excellent presentation yesterday, which completely underpins how this thing is going to be with us for a while, and why the importance of making sure that we look at smart, flexible ways to beat the COVID virus going forward. So thank you very much, Professor Karim. It's great having people who are experts in their field leading the debate on these particular matters, and I think it certainly gave South Africans, in the vacuum of information the last few weeks, some satisfaction that we're in good hands. Remember, South Africa, we're all in this together. It doesn't matter what party you belong to, where you live, what you do for a living. We've all got to pull together to fight this coronavirus. Thank you very much for tuning in. Remember, this Friday, I'll have Jordan Hill-Lewis, our finance spokesperson and Shadow Minister of Finance in the National Assembly. We'll be taking you through our smart lockdown model and answering some of the questions you've been asking around business and the economy and what we can do to make sure we keep it going. Thank you very much for tuning in, and stay safe out there, South Africa. We'll see you on Friday, 2 o'clock. Same time, same place.